So good afternoon, everyone. This series, which I'm going today, this will be a case series only, and this series is about the relationship of the remedies. तो इस सीरीज में मैं कोई ऑर्गेनल नहीं पढ़ाने वाली, बट जस्ट वांट टू शेयर सम केसेस ऑफ आवर डॉक्टर्स हाउ टू अप्लाई द रिलेशनशिप ऑफ द रेमेडीज. फॉर एग्जाम्पल, आपने फर्स्ट प्रेस्क्रिप्शन कर दिया, दैट इज यू हैव डिड योर फर्स्ट प्रेस्क्रिप्शन एंड द पेशेंट इज इम्प्रूविंग बट इट गेट्स स्टक. ठीक है, तो उसके बाद कौन सी रेमेडी देंगे? ओके, और समटाइम्स द पेशेंट इज इम्प्रूविंग, द वन पार्ट इज इम्प्रूव्ड बट द अदर पार्ट इज स्टिल द सेम. Some part is improved and still the symptom is remaining, which is not going. Okay, so that time you have to give that a second prescription. So in the relationship of this remedies, Dr. Poverick, Dr. Boning Hussain, Dr. Clark, okay, even in the Hahnemann, in his like organ of medicines, he described this about this relationship of these remedies, such as in complementary remedies, inimical remedies, antidotes, follows well, and everything. Okay, so let's start with the some cases. Okay, so let me share my screen. Yeah. Yeah. So, relationship of these remedies, in if you go in the book like Boning Hussain Therapeutic Pocket Book, in the last chapter, okay, you will find the chapter in BTPP, the relationship of the remedies, Boning Hussain Therapeutic Pocket Book. Now it was first written as in concordance by the Boning Hussain, but later the Ellen edited and it was changed into the relationship of the remedy. This was in one of the MCQ questions. Okay, so let's start. So it can be like, it will be complementary, antidote, inimical, follows by, which I just now told you. Now, for example, in a case, एक केस यहाँ पर डॉक्टर बोनिंग हुसैन का ही है, that he was suffering from this intestinal obstructions. I think everybody knows. Okay, he's suffering from intestinal obstructions. Okay, so this intestinal obstruction is not due to some foreign bodies. Okay, it is basically, this intestinal obstruction is mainly due to the paralytic ileus. Okay, so basically he was suffering from the ileus. Okay, ileus. Okay, so what happened? Now suppose this is an intestine. Okay, just a rough diagram. So the peristaltic movement which is in the intestine is going on, it becomes sluggish. Okay, it becomes sluggish, बहुत धीमा हो जाता है. As a result, the features will be, there is an extreme pain. Okay, and also the patient will suffer from the constipation, because whenever you eat anything, it get digested, and the other food, it will get propelled out by the stool with the help of this peristaltic movement in the intestine. Now, if this peristaltic movement is halted or it is slowed down, okay, this is called as lack of peristalsis, and this is known as your ileus. Now, Boning Hussain is suffering from this paralytic ileus, and he was suffering from the pain. Now, after reading so many books and going to this Medica, he applied Thuja. Okay, so he took Thuja 30. तो वहाँ पर उतना दिया नहीं है कि why he's given that the book which I'm reading, why he chose Thuja, but he chose Thuja for the complaint of a paralytic ileus. So after taking Thuja, most of his complaint get reduced. Okay, then he wrote a letter to the Hahnemann and asked him about this condition. Now the Hahnemann told him to continue with, to start with the lycopodium, follows with the conium, and after taking the lycopodium and the conium, the patient get improved. That Boning Hussain, he got well. Okay, so this is why Thuja was given, and how it is going into the why the lycopodium and after the follows where the conium maculatum was given. It is only if you go to the book Boning Hussain Therapeutic Pocket Book, or if you go in the Borix Medica, the relationship chapters, which was written by the Gibson Miller, you can get this idea. Okay, so here there will be a, for example, in this I just collected one page So आप देखो कि यहाँ पर लिखा है the remedy, it's complementary remedies, it follows well the inimical, the antidote. Okay, so this is very important, the complementary remedies and the remedies were to follows well. सब remedies अगर यहाँ पर नहीं लिखा गया तो you can go in the BTPB where you get the uh, relationship of these remedies. Okay, now there is another one of, it is very important, that is about your boning Hussein. Croup remedies. Everybody knows that the Boning Hussein favorite croup remedy is aconite, then the spongia and the hepat sulfur. These are given in the rotation, especially in 200 potency. So if a child is suffering from the croup, the aconite was given, and after that it was followed well with the spongia, and after that this is hepat sulfur given in the rotation. Now, another example, it was given in the like one case where a patient is suffering from the eczema in the margin of the hair. Okay, so there is another case where the patient is suffering from the eczema in the margin of the hair. Okay, so at that time, after looking at the condition, the natramure was given. So if you go into the repertory of Kent repertory skin, you go into the head chapter, you get the eruptions on the margin of the hair or the margin of the head, you will get this remedy, the natramure. So natramure was given according to the locations and everything, and the patient got well. Okay, after 2 months, he was again suffering from the same condition. The natramure was given without any relief. Then with the help of the remedies, that like the relationship of the remedies, Rustox was prescribed. Okay, why Rustox was prescribed? When he came, it was a rainy weather. Okay, and if you go with the relationship of this remedy, the natramure, okay, and remedies that follows well, this is the Rustox. Maybe you won't find the Rustox in the eruptions in the margin of the hair, but in this way they get the remedies that follows well. It was a rainy season, and natramune follows well with the Rustox. ठीक है, so इस तरह से relationships of remedies का use किया जाता था. Okay, now there is another case. This I'm telling you why case by case, because it will help you to understand. आपको समझ में आ जाएगा कि किस तरह से complementary remedies का और किस तरह से हम लोग follows करेंगे remedies को. Okay, so basically use for the BHMS student who has started your practice, just started, or also for those who have keen interest in the homeopathy. ठीक है, so later there is another case of a bus driver. So it was a bus driver, and he got transferred to the new bus. Okay, after that, what happened? He came to the clinic and he was suffering from pain in the left inguinal region. So when examined, it was found that he was suffering from the left inguinal hernia. Okay, when asked कैसे शुरू हुआ, कब से शुरू हुआ, okay, then he told that I don't know, but it is since 15 days I am having pain. 15 दिन पहले तो कुछ भी नहीं था. Then it was asked any incident has happened, कुछ हुआ था, कुछ change वगैरह, कुछ anything which is not routine. Then he said कि हाँ, या 15-16 दिन पहले, 2 हफ्ते पहले मैं एक बस ड्राइवर हूँ, तो मुझे एक नया बस दिया गया. The new bus was given, and the clutch of the new bus was very hard. ठीक है, बहुत ज़्यादा टाइट था, बहुत ज़्यादा स्ट्रॉन्ग था, तो मुझे बहुत ज़्यादा स्ट्रेन करना पड़ा क्लच को मूव करने के लिए. Okay, so this is the causation will be that is strain. Okay, excessive strain and the inguinal hernia, and we know that Nux vomica is very much good medicine for the hernia. So first Nux vomica was given. Okay, so after taking the Nux vomica, the patient get well. Okay, उसको कुछ problem नहीं हुआ. Then after like 1 month, he again came with the same complaint, but the complaint was in the in the right inguinal region. Okay, so previously it was in the left inguinal region. For that Nux vomica was given. After that, 2 months later, he suffered from the same complaint of the right inguinal region. So he came with the same complaint again to the same doctor. Okay, and then again Nux vomica 1M 10M and also CM was given. ठीक है, so highest potency दी गई Nux vomica की, but even after that the condition was the same. Okay, the condition was same. Then the book of the relationship of the remedies was uh, sorry, okay, there what he found that the relationship of the remedies of the book was consulted, and he found that one is that this time the inguinal hernia is on the right sided, okay, and nux vomica is the complementary remedies, or it is follows well with the lycopodium. So lycopodium 200 was given and the patient get well with this remedies, okay. So these are some of the cases. Now another few cases, for example, an old man, okay. So this was an case of an old man who is suffering from apoplexy. Okay, uh, an old man of 80 years of age. He's suffering. He suffered from the apoplexy, and as a result, he went into the coma. Okay, so during that time, after seeing the picture, opium was given. ओपियम was given. Okay, opium देने के बाद the patient regained his consciousness. Okay, he regained his consciousness, but he suffered from the left sided paralysis. Okay, but he suffered from the left sided paralysis. So opium is followed well with the phosphorus. Okay, so phosphorus was given. In some cases I have seen some doctor use the Berita carb with the same result. Okay, so if you go in the direction of the remedies, you will see that opium is complementary to the phosphorus, and even the phosphorus has a good sphere of action into the central nervous system. Okay. So if you see the Metromedica, if you read the Metromedica, you will get to know this. Okay. And Bratacarb is also very important with the same thing, because it is very good remedies for the aneurysm, for the apoplexy, and it follows well with the opium. Now there is another case where the patient is suffering from the right-sided hemiplegia. Okay, right-sided hemiplegia, where the causticum was given. We know that causticum is very good remedy for the right-sided hemiplegia. So causticum was given. After taking causticum for like 6 to 7 months for a year, the patient was improving. But his aphasia, okay, was the same. Okay, aphasia में कोई improvement नहीं था. Then same thing, relationship of remedies is consulted and the Brita carb was given. Okay, and after the Brita carb, the patient regained his speech. He get back his speech. Nowadays there are so many remedies. For example, bothrops is one of these remedies, and genopodium anthel also. Okay, but basically this is from the old books, so you will get most of the common remedies are used. Okay, now there was another case. This is a case of an chronic amoebiasis. Okay, the person is a lady of 45 years old. She was suffering from a chronic dysentery. Okay, and with the picture, that is morning aggravation is there and everything, alloy sacrotina was given. Sometimes sulfur was also given. With the help of the alloy sacrotina and the sulfur, she was all right, but the recurrence is not stopping. Okay, it is, she get improved, but the recurrence was still there. Maybe the duration has increased, but it was still there. Later it was found that the patient has that retroverted uterus. Okay, retroverted uterus, and after that, after seeing this, lilium tick was given. Why it was given, it was not mentioned there. Okay, we can think of sepia also, but yes, in retroverted uterus, lilium tick is one of the remedies, and we know that lilium tick is also a very good remedy for the chronic dysentery. Okay, the chronic dysentery. Here it was written that the patient do not have any mental or the physical symptoms of another lilium tigrinum, only with the pathology that she is suffering from chronic dysentery. Along with this, there is an retroverted uterus, lilium tick was prescribed, and allosacrotina. If you with the relationship of the remedies, you will get this remedies in the Boning-Husson therapeutic pocket book. Okay, so there is another complementary remedies or remedies that follows well. That is a patient who is suffering from the cough. Okay, whenever in a complaint, suppose आपके पास कोई पेशेंट आता है एंड ही his complaint is a cough and he's saying that cough as soon, जब भी वो सोने कि डॉक्टर जब भी मैं सोने जाता हूँ ना तब भी मेरी खांसी बढ़ जाती है। सो आई हैव सम टिकलिंग, ऐसा लगता है यहाँ पर कुछ टिकल कर रहा है, मैं लेटता हूँ पता नहीं कुछ खरासी आती है और फिर मुझे खांसी हो जाती है। तो कफ एज सून एज द हेड टचेस द पिलो। ओके, सो रिमेम्बर वन थिंग, बहुत आपको देखना पड़ेगा, कफ एज सून एज द हेड touches the pillow. Okay, so here you need to ask कफ कब सबसे ज्यादा होता है। जैसे ही मैं सोने जाता हूँ ना थोड़ी देर बाद फिर से शुरू हो जाता है। दिस इज योर cough as soon as the head touches the pillow. This is a symptom of a hyoscyamus. But if a patient is saying मैं सो जाता हूँ और कुछ देर बाद मुझे खांसी शुरू हो जाती है आधे घंटे में ही, तो this is cough in the first sleep. Okay, or you can interpret it as that cough on lying down, not as soon as you're lying down, but here will be the cough as the first sleep, where the remedy is Aralia racemosa. Okay, Aralia racemosa. So my handwriting is very bad. Okay, so yeah, what I'm saying that as soon as the head touches the pillow, hyoscyamus is a remedy. And if you see the mouth, you will see there is an elongated uvula. Okay, the uvula is elongated, and there are no remedies. Okay, in other mode of treatment where this elongated uvula can be reduced. Okay, but what I have seen that if you get this picture and if the person is suffering from this elongation of the uvula, so hyoscyamus was given, the hyoscyamus has reduced the cough, but the uvula will be the same. Okay, it is not reduced, but it was seen that after taking phosphorus, and phosphorus has been found from experience that it has reduced the elongation of the vulva. There is another remedies which is known as a capsicum, which I've seen used by so many doctors in the same complaint. So I think you get so many tips in the same video. Okay, please watch the whole video. Okay, now thank you everyone, and let me know how is the if you want anything, just type in the comment box and like and subscribe this. Okay, thank you everyone.